start. You do the introduction.
Hi, Miss Janice. This is Marissa Bryant, and this is Janice Pittman. And I said it right.
Yes.
This is our mid
Olympics D.
Olympics on upper and lower respiratory. Um,
I have to move it for each one. So there's upper and lower respiratory. Move to the first drug.
Upper respiratory infections are usually illnesses caused by an acute infection. They involve the upper respiratory tract, which includes the nose, sinuses, pharynx, and larynx. Some common infections are tonsillitis, pharyngitis, laryngitis, sinusitis, otitis media, and the common cold. There are 18.8 billion cases of upper respiratory infections in 2013. And in 2014, these infections caused about 3,000 deaths, which has come down from the past. Classifications of these are ridiculously long. They are epiglottis, rhinitis, sinusitis, nasopharyngitis. That breaks it down pretty much. Every tract can be broken down. For the lower respiratory tract infections, it's usually pneumonia, but it can include lung abscesses and acute bronchitis. Some of the symptoms for this one are shortness of breath or air, weakness, fever, coughing, and fatigue. And there's a number of symptoms that have characteristics of lower respiratory tract infections, like the bronchitis and the pneumonia. Influenza affects both of these systems. Antibiotics are the first line of treatment, and our first antibiotic is diphenhydramine.
Benadryl.
Thank you, Janice. The contraindications for this drug are hypersensitivity to the H1 receptor antagonist, neonates, pregnancy class B, breastfeeding, children less than 2 years, increased intraocular pressures, cardiac and renal disease, hypertension, bronchial asthma, seizure disorder, stenosed peptic ulcers, hyperthyroidism, prostatic hypertrophy, and a bladder neck obstruction. For nursing considerations, you are supposed to assess for urinary retention, frequency, and dysuria. And if any of these symptoms occur, the product should be discontinued. A CBC during long-term therapy, blood dyscrasias may occur. For respiratory status, note the rate, rhythm, increase in bronchial secretions, wheezing, chest tightness. This product should be discontinued 4 days before any kind of skin allergy tests, and it should also be stored in a tight container at room temperature.
Okay, side effects are hypotension, palpitations, tachycardia, extrasystoles, drowsiness, headache, dizziness, paradoxical excitation, insomnia, euphoria, vertigo, tremors, excitation, disturbed coordination, neuritis, convulsions, confusion, nervousness, irritability, blurred vision, diplopia, dryness of nose and throat, tinnitus, acute labyrinthitis,
It reminds me of the movie The Labyrinth.
hemolytic anemia, thrombocytopenia, agranulocytosis, urticaria. I can never say that one.
I think that's right.
Drug rash, photosensitivity, epigastric distress, anorexia, dryness of mouth, nausea and vomiting, diarrhea, constipation, urinary frequency, urinary retention, thickening of bronchial secretions, wheezing, nasal stuffiness, chest tightness, anaphylactic shock, chills, excessive perspiration, fatigue, and restlessness. Routes of administration are orally, intramuscularly, intravenously. Like I said, an example of this is Benadryl. Indications are relief of allergic symptoms caused by histamine release, including anaphylaxis, seasonal and perennial allergic rhinitis, allergic dermatosis, Parkinson's disease and dystonic reactions from medications, mild nighttime sedation, prevention of motion sickness, and antitussive. It's a syrup only.
The next drug, cetirizine. Any objections?
No.
Okay. Contraindications for this drug are breastfeeding,
Go ahead.
newborn or premature infants, hypersensitivity to this product or hydroxyzine.
Hydroxyzine.
Shut up. Severe hepatic disease, pregnancy class B, children and geriatric patients, respiratory disease, angle closure glaucoma, prostatic hypertrophy, and bladder neck obstruction, and asthma. For the nursing considerations, assess allergy symptoms like pruritus, urticaria, water in eyes at the baseline and during treatment. Respiratory status, again, check rate, rhythm, increase in bronchial secretions, wheezing and chest tightness. Blood studies are LFTs, BUN, creatinine at baseline, and then periodically throughout the treatment with this drug. Also, use hard candy and gum and rinse your mouth frequently for any kind of dryness that this drug can cause.
Is my turn?
Yep.
Side effects include seizures, drowsiness, headache, somnolence, dizziness, fatigue, bronchospasm, hemolytic anemia, thrombocytopenia, hepatotoxicity, pharyngitis, dry mucous membranes, and hypotension. Whatever. This drug can be taken orally. An example of this drug is Zyrtec. Indications are relief of allergic symptoms caused by histamine release, including seasonal and perennial allergic rhinitis and chronic urticaria. Next is albuterol. Your face. Your turn. Albuterol.
Contraindications for this drug include hypersensitivity to sympathomimetics. This is a pregnancy class C drug. Breastfeeding, cardiac or renal disease, hyperthyroidism, persons with diabetes mellitus, hypertension, prostatic hypertrophy, angle closure glaucoma, seizures, exercise-induced bronchospasm or aerosol in children less than 12 years, hypoglycemia, tachydysrhythmias, severe cardiac disease, and heart block. Under nursing considerations, the things to assess are respiratory function, their vital capacity, forced expiratory volume, ABGs, lung sounds, heart rate and rhythm, their blood pressure, check their sputum at the baseline and at peak, whether a patient has not received theophylline therapy before giving dose, the patient's ability to self-medicate, for evidence of allergic reactions. The life-threatening assessment is for paradoxal bronchospasms. If they have those, you are supposed to hold the medication and notify the prescriber if bronchospasm occurs.
Okay, side effects are paradoxical bronchospasm, pharyngitis, rhinitis, dyspnea, cough, tachycardia, chest pain, flattening of the T wave, palpitations, pain, prolongation of QTC interval, ST segment depression, coronary insufficiency, cardiac arrhythmias, hypertension, hypokalemia, headache, glossitis, diarrhea, bad taste, nausea, dizziness, accidental injury, anxiety, tremor, nervousness, urinary tract infection, urticaria, rash, oropharyngeal edema, throat irritation infection, hypersensitivity reactions, angioedema, and anaphylaxis. Routes of administration are inhalation and orally. Examples of albuterol are Proventil, Ventolin, and ProAir. Those are the common ones. It's used as a bronchodilator to control and prevent reversible airway obstruction caused by asthma or COPD. The inhalers are used for quick relief of acute bronchospasm and for prevention of exercise-induced bronchospasm. The tablets, the oral medication is used as a long-term control agent in patients with chronic or persistent bronchospasm.
Next drug is fluticasone. Zone?
Go ahead. I say it different.
How do you say it?
Well, I say it fluticasone, but that's probably wrong because I'm never been sure.
Well, there's no K in there. C.
So are you gonna say flutica?
Fluticasone. Fluticasone. That's probably it.
Okay.
Anyways, contraindications for this drug are hypersensitivity to this product or a milk protein. It's the primary or status. What is this? Asthmaticus. Monotherapy and primary infections. Oh, whoops. Sorry, we're going to the not topical. That's what. Okay. So starting over. It's still hypersensitivity to this product or milk protein. Primary treatment in status asthmaticus. Acute bronchospasm. This is a pregnancy class C drug. Breastfeeding, active infections, glaucoma, diabetes, immunocompromised patients, and Cushing's syndrome.
Okay, side effects are... Oh, go ahead. Oh, your nursing considerations. My bad. Go ahead.
You're just trying to jump the gun.
I'm tired.
And under nursing considerations, assess for respiratory status, such as lung sounds, pulmonary function test during, for several months after, change from systematic to inhalation corticosteroids. Assess for withdrawal symptoms from the oral corticosteroids, depression, pain in joints, and fatigue. The life-threatening assessment is the adrenal insufficiency. Signs of it are nausea, weakness, fatigue, hypotension, hypoglycemia, anorexia. May occur when changing from systemic to inhalation corticosteroids may be life-threatening. Adrenal function tests are periodically done. Hypothalamic, pituitary, and adrenal axis suppression in long-term treatment. Assess the growth rate in children, their blood glucose, and serum potassium for all patients.
Okay, now the side effects. Dysphonia, hoarseness, oropharyngeal fungal infections, nasal stuffiness, rhinorrhea, sinusitis, bronchospasm, cough, wheezing, upper respiratory tract infection, diarrhea, muscle pain, headache, adrenal suppression with a high dose long-term therapy only, low bone mineral density, decreased growth in children, Cushing syndrome, hypersensitivity reactions, including anaphylaxis, laryngeal edema, urticaria, bronchospasm, Churg-Strauss syndrome, and fever. Route of administration is inhalation. A common example of this drug is Flovent. Indications are for the maintenance and prophylactic treatment of asthma, may decrease the requirement for or avoid use of systemic corticosteroids, and delay pulmonary damage that occurs from chronic asthma. And last but not least, go ahead.
Tiotropium. Now I know that's right. Oh no, it's tiotropium.
Okay.
Like a Y.
Okay. Got it.
Contraindications are hypersensitivity to this product, atropine, or its derivatives. This is a pregnancy class C drug. Breastfeeding children, geriatric patients, closed-angle glaucoma, prostatic hypertrophy, bladder neck obstruction, renal disease. Under nursing considerations, assess your respiratory status for dyspnea, rate, breath sounds before and during treatment, pulmonary function test at the baseline and periodically throughout treatment, upper respiratory infections, cough, sinusitis. Tolerance over long-term therapy may occur. The dose may have to be increased or changed. And assess the patient's ability to use handy haler.
All right. And side effects are glaucoma, paradoxical bronchospasm, tachycardia, dry mouth, constipation, urinary retention, urinary difficulty, rash, hypersensitivity reactions, including angioedema. The route of administration is inhalation. A common example of this is Spiriva. Indications are long-term maintenance treatment of bronchospasm due to COPD and reducing exacerbations in patients with COPD. I've taken a picture of each section of this board, and I'll submit that. Marissa is going to submit this video via YouTube. We'll give you a YouTube link. Do you want to say bye?
Bye.